welcome to the Explainer. Okay, let's dive right into this. We know you've been asking us to make a comprehension explainer with 15 key points to pass your ATI. Well, we hear you loud and clear, and we want to make absolutely sure you have exactly those 15 key points for your ATI exam completely mastered by the end of this session. We are taking a seriously dense textbook chapter on neurologic disorders and distilling it into the exact, high-yield info you need to succeed.
We've carefully combed through the source material to bring you exactly 15 absolute must-know key points. These aren't just random facts, They are the core, fundamental concepts that consistently pop up on nursing exams. If you can lock these 15 points into your memory, your comprehension, and honestly, your confidence on test day is going to skyrocket.
Here's how we're breaking things down today. 1. Acute threats. 2. Infection and inflammation. 3. Guillain-Barré syndrome. 4. Parkinson's disease. 5. MS and ALS. And finally, 6. Final exam tips.
Let's start with Section 1, Acute Threats, specifically looking at seizures and trauma. Here is point number 1. If you see an ETI question about seizure precautions, this exact quote from the text is a massive red flag. The source emphatically states you must never, ever attempt to insert a tongue blade or force any object between a patient's teeth. Why? Well, attempting to force an object between clenched teeth can cause severe injury to the mouth. Plus, if the patient bites down and breaks it, they could swallow the object, or worse, it might fall back and completely occlude their airway. Moving to point 2, status epilepticus. This brilliantly illustrates a true medical emergency. We're talking about continuous seizures or repeated seizures without recovery, lasting for 30 minutes or more. The absolutely crucial thing here is that prolonged seizure activity rapidly depletes the brain of vital oxygen and glucose. That can lead to permanent brain damage. Your immediate priority, maintaining a patent airway and administering intravenous anticonvulsants, usually starting with a drug like lorazepam.
For point 3, let's look at head trauma. You've really got to know how to contrast hematomas. The textbook makes a vital distinction here. Epidural hematomas result from arterial bleeding, meaning they pump fast. The patient will typically have a momentary lapse of consciousness, wake up, and seem alert, and then deteriorate incredibly rapidly. On the flip side, subdural hematomas result from tearing of the veins. Because it's venous bleeding, it is much slower, meaning symptoms might actually take days, weeks, or even months to develop after a seemingly low-impact injury.
Point 4 is all about increased intracranial pressure, or ICP. The name of the game here is prioritizing actions that prevent any spikes in pressure inside the skull. You want to elevate the head of the bed, but absolutely prevent neck and hip flexion, because bending blocks that venous drainage from the brain. Also, you must strictly limit suctioning and consciously space out your nursing care. You don't want to overwhelm the patient and drive their pressure up all at once. All right, Section 2, Infection and Inflammation, recognizing and managing brain infections. Point 5 focuses on recognizing meningeal irritation. If an exam question mentions a positive Kernig or Brudzinski sign, warning bells should immediately go off for meningitis. A positive Kernig sign means that when the patient's hip is flexed to 90 degrees, extending their leg causes severe hamstring pain. A Brudzinski sign means when you flex the patient's neck, their hips and knees involuntarily flex right up in response. Point 6 highlights the community health and prevention side of meningitis. The text explicitly outlines a highly testable timeline here. Meningococcal vaccinations are recommended for all adolescents at age 11 or 12, with a necessary booster at age 16. It also points out that college freshmen living in dorms are a high-risk group. Furthermore, anyone in close contact with a patient diagnosed with bacterial meningitis requires prophylactic antibiotics to prevent a deadly spread. For point 7, we're contrasting headaches. Knowing the difference between these two will help you rapidly narrow down your multiple choice options. Migraines are often unilateral, they might be preceded by an aura, and they're frequently triggered by things like stress, menstruation, or thymarine-rich foods. Think aged cheeses and red wine. Contrast that with cluster headaches. These strike suddenly with absolutely no warning. They occur in a series of episodes, are intensely painful, and are often accompanied by a tearing eye and nasal congestion. Moving on to Section 3, Guillain-Barré syndrome, and the danger of ascending paralysis. Point 8 is identifying the classic presentation of GBS. The textbook describes this as an autoimmune response that essentially destroys the myelin sheath of peripheral nerves, typically triggered by a recent viral infection or even a vaccination. The absolute hallmark sign you are looking for in a test prompt, ascending symmetrical muscle weakness. It starts in the lower extremities, the feet and legs, and steadily creaks upward towards the trunk. Now, before we reveal point 9, I want you to actively think about this. As that symmetrical paralysis ascends from the lower extremities, up through the legs, and into the torso, what vital, life-sustaining system is inevitably going to be compromised?
The answer is point 9, respiratory failure. As that paralysis reaches the chest, it knocks out the muscles of respiration. The text explicitly states that respiratory dysfunction is the single greatest threat to patients with GBS. Your priority nursing action here is to frequently assess the patient's vital capacity, keep a close eye out for a respiratory rate greater than 30 breaths per minute, and be fully prepared for potential mechanical ventilation and intubation.
Section 4. Parkinson's disease. Managing chronic degenerative movement.
For point 10, let's ground your understanding in the pathophysiology. Parkinson's is a progressive degenerative disorder caused by a deficiency of the neurotransmitter dopamine within the basal ganglia of the brain. The loss of this specific motor function controller is exactly what causes the highly testable triad of symptoms: tremors, bradykinesia, which just means extremely slow movement, and muscle rigidity.
Point 11 is highly actionable for your exam. Patients with Parkinson's often experience a terrifying freezing of their gait, where they suddenly feel completely stuck to the floor. When you are teaching a patient how to overcome this and improve mobility, the text gives us 3 exact, evidence-based nursing interventions. Teach them to scoot to the edge of a chair before trying to stand up. Have them consciously march in place before taking their first step forward, and tell them to practice lifting their foot as if they are stepping over an imaginary object on the floor. Section 5, MS and ALS, differentiating neuromuscular decline.
Exam writers absolutely love to test your ability to tell these next 2 conditions apart. Point 12 focuses on multiple sclerosis, or MS. MS is a chronic disease where the protective myelin sheath surrounding axons in the central nervous system is essentially chewed up and destroyed, leaving patches of sclerotic tissue. Because the damage is so varied, the disease usually presents with a really unpredictable, exacerbating, and remitting course. Patients will have periods of intense fatigue, visual disturbances, and weakness, followed by periods where symptoms partially subside.
For point 13, you must be able to contrast MS with ALS, also known as Lou Gehrig's disease. Unlike the unpredictable remissions of MS, ALS is a rapid, steadily progressive degeneration of motor neurons. There is no getting better. What makes ALS particularly devastating and highly testable is that while the motor neurons die, causing profound muscle wasting and paralysis, the patient's intellectual ability, sensory perception, and hearing remain entirely intact. They are completely aware as their physical body fails.
Because of this tragic trajectory, point 14 centers heavily on ALS nursing priorities. As weakness hits the oropharyngeal muscles, your care must aggressively focus on airway management and preventing aspiration. You've got to elevate the head of the bed during meals and likely implement a feeding tube later on. Plus, because cognition is untouched but speech is lost, establishing alternative communication methods early, like blinking for yes and no or using picture boards, is an essential nursing intervention to prevent total isolation. And finally, Section 6, final exam tips. Universal neurologic safety interventions.
Point 15 ties the whole shebang perfectly together. Universal patient safety. No matter which of these complex diseases you are faced with on a multiple-choice question, if an option prioritizes protecting the patient from harm, it is very likely the correct nursing action. Whether it's implementing strict fall precautions with a low bed, monitoring for dysphagia and aspiration, turning the patient every 2 hours to prevent skin breakdown, or simply allowing a patient with bradykinesia extra time to eat and communicate. Prioritize safety, protect the airway, and you are going to absolutely dominate this section of your exam. But beyond the exam, ask yourself this. As medical technology advances, how is our approach to these devastating neurological declines going to change in the next decade? Will we one day see a true cure for ALS or Parkinson's, or will patient safety and management remain our primary weapons? Keep questioning, keep studying, and we'll see you on the next explainer.